Good morning. Have a good day. So, welcome to another important class that connected with GIS application in the health sector. That effective and efficient management of public health system. So, we have discussed the application level in water resource management, how to manage effectively the water resources. We have used that technology, means that different level of application in that GIS. Hope you people are understanding my classes, video lessons, and some people are asking doubts, some are not asking out. Some people are regularly watching the lessons, video lessons. Some people are not watching. Some people are regularly attending the assessment. Some people are not attending, and we people are watching all those things. We are observing each and everything. Okay, so kindly watch the videos regularly. Ask your doubts in the live sessions, 2 or 3 live sessions. uh, Come with your assessment regularly. That's good for maintaining a good learning atmosphere. And see, again repeating that same wording. Cartographers and geographers, we people are studying about geographical process, geographical pattern, and geographical behavior, different geographical phenomena, and all those things. We people are analyzing. We people are preparing certain thematic maps for better world, for better future, better present, for better decision making. So in this video also we are discussing such kind of an topic, that how the GIS technology is applying in the health sector, fine, extracting data, visualizing data, fine. See that in that what we people are doing, we people are collecting, storing, manipulating, displaying, analyzing for better future and better present. Fine. So we people are visualizing or analyzing the geographical pattern, geographical process, geographical phenomena, geographical behavior. So here we people are mapping the health condition. You know that, see, nowadays we people are our government is also mapping certain corona and those things, and certain cartographers are also preparing certain uh, certain maps, thematic maps, that pattern of spreading diseases, location of different medical facilities, right? That including hospitals, health centers, primary health centers. See, you can see that these kinds of mapping activities in OSM, open street map. You can see that in Google Map. I have already given a video. You can see that how the hotspots are mapping, how different medical facilities are mapping. So let us start our lesson. That is vital, important, how the application level is working. So that in health sector, types of GIS application in health, that is analytical, reporting, data transformation, and spatial database queries. So analytical means we are analyzing the spatial data, geographical data. Reporting means storing the geographical data, or data collection. Data transformation is after analyzing the data, we people are preparing certain thematic maps with the help of machine means computer, software, and hardware. We people are preparing certain thematic map for better decision making. Thematic map or map is a decision making tool. Spatial database queries, fine. We have explained these kinds of things. And see, one of the most important way of understanding the spread of diseases and all those things, that is that method that is known as hotspot analysis. where the diseases are more. You may very familiar with the term hotspot, corona hotspot, containment zone, clusters. So nowadays you people are very much familiar because it is corona time, COVID time. You people are very familiar with the containment zone, hotspot, cluster, this kinds of terminology. So hotspot analysis is a method where the um, more diseases or more number of patients are concentrated. You can read the definition. Then John Snow, you should remember this word, this name, Dr. John Snow. He is the first, he is a person work. He was the person contributed towards the geography and this medical epidemiology, right? He is the person prepared a map showing the spread of cholera. That I will show you the map. See, you can read this. What his work, fine. That snow study was a major event in the history of public health and geography. It is regarded as the founding event of the science of epidemiology. So that was happened in 1954. Nearly 117 years back. Fine. In that time he prepared a map with the help of just pen and pencil, fine, where the how the cholera is spreading, fine, cholera map. This is his map that he is the pioneer in the field of health, that using the geographical method, geographical pattern, or geographical way of analyzing certain diseases, the spread of diseases, that cholera spreading, right? So John Snow, he is the pioneer in the field of that mapping certain medical issues, right? That is his map. You can you just search on Google, Dr. John Snow's map, Dr. John Snow's cholera map. You will get lots of information. And one another important thing, that kernel density. It is just mapping the density of patients. You can read the definition, right? You can read the definition. Density, see, it is a tool using for different purposes, but in case of this medical facility, in the case of medical facility also, we can use this kernel density tool. It is available in ArcGIS or any other, I don't know about other open source one, but in ArcGIS this tool is available. And this Dr. John Snow, he was also used the same tool to map the spread of cholera, not in the way of that with the help of machine. He prepared just based on calculations. Kernel density, actually it is from statistics. We people are using for certain mapping and a thematic, preparing certain thematic map and analysis. You can read the definition and all those things. This is the definition, you read it, right? Then see, this is a way of map that showing where the more dense and where the less, fine, where the high density and where the low density, right? It is based on certain dot map, fine. I already said point, line, and area specification. Point, polyline, polygon feature. Example of spatial database queries, identifying and locating disease clusters. You know that the word, what you mean by cluster? That is location of certain diseases, fine. That is here, cluster means that locating target population, identifying and locating community resources useful for intervening programs. What type of studies can benefit from GIS? Calculation and visualization of morbidity and mortality rates of regions, calculation of distance variables for statistical testing. Distance variable means how far a medical facility, that may be primary health center, local health center, hospital, whatever it is, what kinds of facility, and the distance, means that accessibility of certain medical facility. What type of studies can benefit from GIS? Data visualization from a spatial perspective. That means preparing certain tabular data, we are preparing certain tabular data and converting with the help of machine. We people are converting that to thematic map, identifying geographic patterns, risk communication, communicating geographically related risks. What type of studies can be done in GIS? Disease cluster analysis, that locating certain clusters, locating larger than expected incidences of a disease related by time and place. Analytical value of cluster analysis imprises measure of time, imprises measure of place, incomplete clinical data. That means we can't collect this kinds of data from the people without their permission. See, you know that some certain issues that happened in the April and May, that the courts intervention and all things, right? It is a personal data. This kinds of data we see that is connected with certain privacy issues and all those things. This is cost analysis for there to be causation. The risk must be in geographical proximity to the case and predate the disease. Privacy and confidentiality issues. That means the personal data, medical history of a person, that hand overing with the certain authorities, that kinds of issues. In what kinds of issue we people are facing in the case of health sector? That means the medical history of a person, that is clearly connected with privacy and a personal information. Most of the people are not willing to share this kinds of information, and this is few maps that is prepared by me for certain purposes, right? Some other purposes, you can see that that is clearly connected with COVID-19, coronavirus disease 2019, and this is about quarantine. This is a map that was prepared in what in April, right? And this is prepared in June for some other purpose, not for you, some other purposes. So that is all about today's class. You can always ask your doubts. Kindly and regularly watch the video lessons and attend the assessments. Ask your doubts and questions in the live sessions. So thank you for watching my video lesson. Kindly come with your doubts and all those things. Watch, see, for Health GIS, I have prepared 2 videos. Watch both of them. So thank you, thanks a lot.